Sconiers, who is here with us on the call this morning, or this afternoon, sorry. Dr. Sconiers, do you want to say take a few minutes to introduce yourself and say a little bit about yourself and your role with the consortium?
Sure. So I am, as Dr. Eric King mentioned, the DEI director for the consortium. Super excited to have just celebrated 2 years in this role. It was an inaugural position, and so we were excited to sort of just see what the needs were and how things could evolve. So I get to work with a phenomenal group of people, including interns, DEI consultants, training directors, and really just help to influence policy and climate of the different regions, different settings, and things like that, just based off of what needs we've learned about, what support we've been able to offer so far has been like programming, looking at website policies, being able to create new programming. And then I meet monthly with the DEI consultants for each region, including Dr. Dershowitz, who has been phenomenal, who used to lead the diversity committee actually, and has just played an incredible role in making sure that we are being inclusive in our practices and our policies. And we have how many regions at this point? Almost, okay, 4. I was like, I know we have another one that we're considering starting too, but it's a really exciting time to be a part of the consortium. And oh, thank you, Mallory. That's really sweet. I really appreciate that. When I started with the consortium, my title had an add-on and it included intern experience, which really allowed me to focus on making sure that interns feel supported, that they have an advocate. So I really take that role, even though my title no longer reflects that, I take that role with me in everything that I do going forward. So I look at my role as what can I do to see interns, to know what's important to you, to know what your needs are, and to see that you know that I'm a person who can advocate for you in whatever ways possible to ensure that this is a good training year for you. So I appreciate the opportunity to have a little bit of time with you all today. I'll stick around for a few more minutes. So if you have any questions for me in the chat, I'd be happy to answer them. But also, my email address is here. If you did match with the consortium later, I would send an email and congratulate you and ask you about days that are significant to you as a way to just make sure that from day one, when you know that you're with us, we're interested in getting to know more about you to try to tailor the internship year to what it needs to be for you. Thank you all for
Thank you,
having me.
Dr. Sconiers. Appreciate
You're
that.
welcome.
Thank you very much. And like she said, she'll be on for a little bit longer. So if any questions, don't hesitate to send them through chat. And you're more than welcome to email us at any time as well. And so we also wanted to make mention, Dr. Sconiers already mentioned Dr. Dershowitz as well. She is our DEI consultant for the Great Lakes region. So she helps to support Dr. Sconiers and help to support our efforts in that region there. So I'm going to spend a few minutes kind of giving just an overview of our history. So National Psychology Training Consortium, or NPTC, was originally created in 2003 out of a workforce grant between an inpatient setting here in our central region and Forest Institute, which was an academic program graduating psychology interns. And so those two came together with this grant to help to develop workforce opportunities for very rural and underserved communities, those communities where it's really hard to get individuals into those communities. So post that 3-year grant, we realized very quickly that this wasn't just a 3-year need. This is a need that we have ongoing and a need across multiple different states and regions. And so that grant in 2003 developed and really launched us into where we are now, just celebrating our 20th anniversary. And as Dr. Sconiers mentioned, with our 4th region and the 5th one right following right behind it. And so we are super excited to be able to serve all of the different areas that we serve and be able to help really provide that workforce in these areas. So our Great Lakes sites, we are spread out over the state of Indiana, and we have a lot of different opportunities and experiences. So I won't spend a ton of time taking up airtime because I know you want to hear from our sites. So I'm going to turn it over to a few of our sites to talk about their experiences that they have there. But before I do that, I want to give you a little bit of background um, and tell you a little bit about kind of what we have done here in the Great Lakes region all around. So We were accredited in 2014 for the first time and have received our 10-year accreditation with our next site visit to come in 2031. So we are very, very excited about that. Since our inception in this region, we have successfully graduated over 170 interns within this region alone. So within our Great Lakes region, which we're very excited about. And we currently have 15 interns placed at 5 different sites, like I said, throughout the state of Indiana. Each of those sites is going to tell you a little bit more about themselves and the experiences and rotations that they have available. So you'll get a chance to hear a little bit more about that. All right, anything else that I need to cover, Mallory, before we jump in and kick into each of the individual sites? Oh yeah, I skipped the alumni one. I can touch on that one if you want me to. Okay, sorry, I'll give just
Yeah,
another
that's
little
up to
brief
you.
overview real quick. I won't spend too much time on this. Like I said, I want to make sure we have enough time to go over all of our sites and answer any questions that you all may have. But for the consortium as a whole, we have trained over 600 interns. Like I said, over 170 of them in this region alone, but over 600 since our inception. And what we're really excited about, and what I think you will hear from each of our sites as they talk with you about their experiences today, is when we think of this internship year, yes, it's the year that you are really taking what you learned in your academic programs and you're applying that, you're getting some of those hands-on experiences. But we don't look at this as just a one-year training opportunity. We are invested in the interns, invested in the training, and our goal is to keep you long-term and to keep you engaged into the consortium. So we have lots of postdoc opportunities, lots of employment opportunities following that 1 year of internship. So we're very invested in that 1 year of training and beyond that. And so what you will see is that of the over 600 interns that we have trained so far, over 200 of those have stayed with an NPTC site post their internship. So we really do encourage you to talk with your sites that you match with about postdoc opportunities and employment opportunities moving forward. And the other unique aspect about that, all of our sites do serve these very rural and underserved communities, which makes many of them eligible for National National Health Service Corps funding and NHSC loan repayment opportunities. And we have about 50 psychologists or alumni with us that have received that funding before. So again, lots of opportunities post your internship and post that postdoc opportunity. Okay, with that, I will turn it over to our sites. And so I'm going to probably kick it over to one of you, and then I will let you each kind of tag on another person when you are finished, if you don't mind. So Dr. Griffin, do you mind to start for us? Or do you want to go in order, Mallory? Do you want to go in order of the slides?
That would probably be easier.
Okay, perfect. Let's do that. So we'll start with Center Stone. So Dr. Sklar, that is you up first. You get to kick us off.
That will be me. Well, welcome everybody, and best of success with this application and match process. It doesn't create too much anxiety. I have been with Center Stone for about 35 years, so have a good sense of community mental health. We've been with the consortium, I think it's 5 or 6 years, and it is an absolutely amazing organization, which allows us to really focus on training pre-doc interns, which I really enjoy. So we are located in Columbus, Indiana. It's a town of 50, 60,000 people, but we serve a lot of the very rural areas around Columbus as well. We are kind of expanding with developing FQHCs, and we have 4 FQHCs in our mental health centers. And currently interns are located both in the Columbus FQHC and in Bloomington. So we have a lot of flexibility built into our internship. There are some core requirements. You know, we want everyone to kind of get a taste of the best that community mental health has to offer. So to give you, a flavor of maybe doing things you don't want to do, like working with kids. Oh, gasp. as well as working with some um, severe and persistently mentally ill, people as well. So we have 4 positions. 3 are traditional intern slots with an asterisk, and 1 is a full-time integrated health intern position. The asterisk with the traditional slots is we have kind of a hybrid. We have 2 interns that are doing 2 days in traditional settings and 2 days at the FQHC. So they get a good mix of just about everything. The one purely traditional internship, we usually put them in a very rural, smaller town, about 25 miles from Columbus, just to work in a very small office and to get a sense, be a team member in that office. We give people experiences in adult working with the serious and persistently mentally ill population. We have people doing work with kids. We have 1 intern who's currently placed 1 day a week in an alternative high school. You will maintain a very diverse clinical population. Just open up the DSM, close your eyes, and pick any 2 diagnoses, and you will probably find that. We give our interns experience working with SUD. We have 1 intern who really wants to focus on that, so she has a little more time invested there. We have crisis services. We have the Stride Center, which is an interesting concept. It's a storefront, a walk-in crisis center where people can get a little help for some crisis intervention or to be referred to community resources. We give our interns plenty of psych testing and a whole lot of individual and group therapy. So our interns typically like our intern program. We've kept 2 who are now primary supervisors with us, and hope to keep more. That was a lot.
Thank you, Dr. Sklar. And we will probably feel free again, any of you, to throw any questions in the chat, and then we will have hopefully some time at the end that we can answer any questions. So if you have them about specific sites or in general, we can cover those at the end. So next we will have Valley Oaks. And who do we have here from Valley Oaks? Is that Dr. Yarbrough?
Yes, hello. I'm filling in for Dr. Kulkarni. She had something else pop up, so. Yeah, so hello everyone. So glad to have you on and expressing interest in NPTC. I am actually an alumni, so I was one of those interns who got to stay on, and now I get to supervise. So it's been a really fun full circle moment. So Valley Oaks, we actually have 9 different counties that we provide services in. Our interns actually are in a mix of, they'll be in 2 counties. So depending on which track that you're in, we have 2 generalist tracks that are more in our, what we call our outlying counties. So in Crawfordsville area, which is Montgomery County, and then Delphi, which, oh goodness, I don't want to misspeak of which county that is, but, and then our child and adolescent intern who's in Tippecanoe County. So we have the ability to tailor kind of whatever you're interested in. We have the ability to do individual therapy. We do a lot of groups. We're really trying to expand our group therapy offerings just because there's such a high mental health need, and we're trying to, meet all of those needs through groups. We also just launched our primary care office. So primary care is going to be serving all of our counties. So that was about a year ago. So we're trying to move towards becoming an FQHC as well, and integrating the mental health and the physical health care too. So we have case managers and then the prescribers as well. So all getting to work together on a treatment team. So you get a variety of experiences.
Thank you, Dr. Yarbrough.
Yeah.
Okay, next up we have adult and child health. So that would be Dr. Frederickson.
Thank you. So I'm Dr. Frederickson. I'm the training director here at Adult and Child Health. This is actually our first year with interns, so it's been a really exciting start to the year. There's 4 of us psychologists that kind of get to work really hands-on with interns, and we've really enjoyed our time with them. It's very exciting and invigorating. So definitely enjoy our time there. So we also, just to give kind of some oversight of what the interns are doing, similar to kind of Dr. Sklar's site, they work in the FQHC 2 days a week. And then we give our interns an opportunity to kind of specialize in an area that they're interested in. So this year we have one intern that's really interested in testing. So she's doing a lot more of our consultations and kind of getting that experience of determining if, you know, an evaluation is needed and medical necessity and all that great stuff. And then our other intern was really interested in child welfare. So we've kind of embedded her with our child welfare team, so she gets to work with some of our foster care youth. Some other opportunities are just more time in the clinic. So we're really actively working on being a really integrated center. And so actually right now we're in the process of kind of adding some of those primary care codes that psychologists would work under and getting to do some more integrated behavioral health with interns. And so some of that is up and coming. There's also opportunities to work in our crisis center. We have like a living room walk-in crisis center that we just opened recently this summer. So it's really exciting. So there's an opportunity for interns to work in that if they have interest in that. And you would work on a work with a prescriber and then 2 other skills specialists. So there's like a staff of 4 that work those clinics, and you just kind of work with clients to get them stabilized or provide them to extra resources. And then the other opportunity would be school-based services. So if an intern wants to work with youth in our communities, they can do school-based and community work. So that's another kind of opportunity. And we really want interns to kind of tailor their experience to what they want and where they would like to grow in. So we have 2 positions, and they are generalist positions, just to be clear, but have the opportunity to grow in some other areas. Substance use is another area if an intern is interested. And then that 4th day, we definitely have psych testing as part of a regular kind of thing that they'd like to do, but they can add in more of that if they'd like. So yeah, I think that's us so far in a nutshell. And please feel free to let me know if anyone has any questions. I'm happy to answer them.
Thank you very much.
Mhm.
Okay, we will move on to Aspire. So for Aspire, we have Dr. Dross Gonzalez to represent.
Thanks, Dr. King. Hi, everyone. Thanks so much for joining us today. I know this is a very exciting and maybe nerve-wracking time, so I'm really happy that y'all have joined us and hope to see you with us next year. Aspire is a community mental health center and federally qualified health center. So we have integrated care at all of our outpatient clinics. So you will have the opportunity to be placed at one of our clinics, either in Indianapolis, Carmel, Noblesville. Those are primarily where we place our interns. So you will be there for the entire 12 months, providing both individual, group, psychological testing services. That's where you will carry the majority of your caseload. In addition to that, you will be able to do 2 6-month rotations, one in our substance use disorder rotation. And we have a full continuum of care from residential treatment to recovery homes to transitional housing to outpatient care. So you'll be able to kind of see all of those levels of care for individuals who are managing their substance use disorders. You will also serve 6 months as a behavioral health consultant. So within that role, you will be working with a primary care clinician, doing warm handoffs. You will shadow their sessions with their patients. And if something comes up, you know, if it's something like diabetes management or tobacco cessation or, you know, mild anxiety, depression, they'll do a warm handoff and you'll be able to kind of take over where they left off and provide some of that short-term care to those individuals. We also offer psychological testing services. Some of those are more brief, you know, screeners, things like that, just to identify needs. And we also do full battery testing here. Most of those referrals come from the Department of Child and Family Services. So a lot of times we're working either with the parents or the children to aid in diagnostic clarity, also to help with treatment recommendations and, trying to identify what those next steps might be to ensure that we get all of their needs met. We have a great record of keeping interns. So right now, when I look at all of our supervisors, we actually have 4 licensed psychologists who we have brought over from our internship. And that's pretty amazing because we've only been with NPTC. This is our 4th year. So it's really great to look at who devises our supervisors and say that more than half of our licensed psychologists here are actually from this consortium. So we really do look at this program as a pipeline to employment. It's really important to us that we get individuals who have a heart for CMHC, who want to be here, who want to work with the underserved population, because we really do want to keep you and help you grow and develop. On your internship, we look to you as a leader, and we start to develop those leadership skills, within you. You get to lead our integrated care staffing, which is devised of medical doctors, psychologists, psychiatrists, case managers, licensed therapists, and about halfway through the year, you're going to be leading that. So you get looked at as a leader, who's consulting on cases and really being that behavioral health expert in the room, obviously with a lot of support, but we want to really carve out those leadership roles as well. So again, I really hope that we have some of you joining us. We're always excited to help foster that growth and development in everybody as they move through this process. Thank you.
Thank you, Dr. Dross-Gonzalez. That is a great representation of what we strive to do. Like we said, that our goal is to train you all and interns throughout the course of that year. And then we really are passionate. It's what we do, is to serve those rural underserved communities, and we want to keep you, and each of our sites want to keep you and keep you connected. And so that is a great representation. And Dr. Sklar kindly pointed out that you might even have some individuals that have completed an internship across a different site that end up doing a postdoc or employment other places. And from a consortium perspective, that's a beautiful thing to see, again, because across the state, there are so many needs and pockets of needs that our goal is to keep you connected at some point in one of our sites in the consortium that is serving very rural and underserved areas. So last but surely not least, we are going to turn it over to Dr. Griffin to talk about Bowen, and then we will open it up for some general questions and discussion.
Yes, so that's a good transition because I am an alum. So I did my internship through NPTC and then stayed on at Bowen. I've been here about 6 years, and I would say, kind of in line with everybody else, our psychology team is probably about half NPTC alums. Bowen Center, we have 13 brick and mortar buildings that are also CMHC and FQHC. So every brick and mortar office has our community mental health outpatient side. It has psychiatric medication providers, and then primary healthcare providers all in one building. And then we also have our services span beyond our 13 services into other counties with more of our skill-based services and virtual care. We, as mentioned before, we see the continuum of individuals. It's rural mental health. So a lot of times in our counties, we're pretty much it. And so we really want interns that can kind of be willing to go outside of their comfort zone with support and supervision to provide care across the lifespan and across diagnoses. I think we really treat it as a generalist training year, and we want you to get all the experiences that you can while you are surrounded with supports and supervision. With that, so we do therapy, which could be individual, group, family, couples therapy. We have quite a few groups, so a lot of them are substance use-based groups. We also have parenting groups, those types of things. We have, in addition to those settings, we also have a psychiatric hospital for adults. So there's opportunity for individuals to do some training there. We have transitional living facilities for individuals that have severe mental illness who are working towards being transitioned back into the community. And then we have a methadone clinic. So as part of our continuum of care for individuals struggling with substance use, there's an opportunity to kind of see that process and how that works and provide services in that setting. We are taking 3 individuals, and we really value our interns. We want to grow from them as much as we want them to grow from us. And so we incorporate them into our psychology team, and they're welcome to come to our psychology meetings. And when the psychologists all get together, we include the interns. We do quite a bit of psychological testing. And again, that ranges from briefer models. We're starting this like ADHD clinic where we have certain days where we from outpatient or our med side get referrals, and we see a bunch of people in one day so we can get those results quickly and they can start getting the treatment that they need. And then as mentioned before, we also work with our community partners. So whether that's the Department of Child Services or juvenile probation, doing a lot of like diagnostic clarification, treatment recommendations, that type of things. Our HSBPs do quite a bit of autism testing, so there's opportunities to kind of shadow and co-score and grow and learn about that type of testing. I think those are the main ones. We also try to provide either shadowing or education around the different types of testing that maybe you can't do until you're licensed. So interns can have like a foundation on that. All right.
Thank you very much. Several of you hit on this, but I'm going to kind of talk broadly, on a few of those training opportunities. And then, Mallory, if you don't mind to kind of have, I know we often every year get a list of questions and just kind of have some that we can throw around, maybe to give the chance for some sites to talk specifically about, some of the opportunities that they have at each individual site. But I wanted to circle back to a few of you mentioned, as training directors, we specialize in that generalist training. So for this year of internship, this will be a generalist training year. And as you heard, many of our sites have those more specialty opportunities and tracks and rotations. So our goal is to really, I think Dr. Sklar said it, but we're going to give you those foundational pieces, and we're going to challenge you outside of your comfort zone in some areas where we do see the lifespan. We see individuals with lots of different presenting concerns, and we have each of our sites have a lot of those specialty rotations, specialty opportunities. And so you're able to really spend this year getting very well-rounded experiences and opportunities where you will get those foundational pieces and you will get access and exposure to a lot of those more specialty and nuanced areas to really let you leave that internship year feeling like you have everything that you need for that generalist piece and a really good start into that postdoc year in some of those specialty and nuanced areas that you maybe are more interested in and want to specialize in. And we also look at this year as being a year that it is your year to kind of practice and try some things that maybe you have been less comfortable with, haven't done before, under supervision. And so our sites are really invested in you and invested in giving you that training, supervision, and exposure to some areas that maybe you want more of. So Mallory, do you have a list of questions prepared? And before I turn to you to do that, anyone want to take yourself off mute, ask any questions, whether that be generalist or to a specific site, and then we will go from there.
We actually had a really great question submitted in the chat. For the NPTC alumni who are present today, could you comment on what skills, experiences, and/or qualities really helped you succeed and stand out during your internship year? Great question.
That is a great question. Thank you. Anyone want to answer?
The question
I don't mind to answer, but I will turn it over. Yes, Dr. Griffin.
The question was what skills helped us stand out? I would say being able to practice independently, but also recognizing when I needed to seek out support. So being willing to try new things, but also knowing my limitations and saying like, hey, I need extra support in this area, or could you shadow me in this area? I need an extra training on this area, those types of things. Yeah, I would say that was the main thing.
I may add to that while anyone else wants to take themselves off mute and contribute as well. I am also an alumni of the consortium, by the way, way back. But in our central region, did my internship at an inpatient facility in our central region. And one of the things I saw in that internship year, and also I've had the privilege and the benefit of sitting in different roles in the consortium and seeing interns come through every year, that I think I can confidently say, what makes a good intern, a successful intern every year, it is less about the knowledge, skills, and experiences you come in with, to be quite honest. And it's more about your willingness to learn, being open, motivated, and willing to learn and absorb every opportunity that's presented to you. Of course, we want an individual to come in and have good foundational skills, knowledge, and experiences for sure. And we are all invested in that training. And so if an intern comes in and says, I don't have as much experience in assessments is a good area. I don't have as many assessments under my belt. I don't have as much experience in this area. Our sites will really lean into that and say, if this is something you want to do, we will help you develop those skills, training, and experiences to help give you that foundational piece. And so, it really is just that openness and willingness to learn more and being motivated to learn and grow over the course of your internship year that makes for some of the most successful internship years that we can see.
Yeah,
Anyone else want to speak to that question? Yes, Dr. Sklar.
I just wanted to add something about testing experience. With COVID, a lot of students have really gotten hurt with a lack of testing experience, and we certainly take that into account, and we do give a lot of supervision with testing. Even if it's not something that you like or that you think you'll ever do again, we need you to be competent by the time that you leave us. So there's a lot of supervision, scheduled supervision, as well as individual supervision when needed. So.
Great, thank you. Any other questions in chat, or feel free to take yourself off mute?
I have some pre-submitted questions. I'm going to go ahead and send a copy into the chat as well. This question is, do any sites offer opportunities for community outreach or population intervention?
I can speak to that. So at Aspire, we have a mental health awareness grant that my team actually facilitates that. So the interns participate in that. So we do different types of outreach. We have a whole community engagement and outreach. This past weekend, we were at the AIDS walk. We're constantly out in our community doing things, providing free training. But this grant in particular provides suicide prevention training, QPR training, mental health first aid training. So the interns have the opportunity to go out into the community to provide this free education to our stakeholders, to schools, to anyone who we have contact with. And then again, outreach just throughout the year. We have so many different things going on within all of our communities, and we're constantly out there, going to different fairs, free education, whatever we can do. And interns can absolutely be a part of anything that they would like to. Most of this, of course, is after working hours on the weekends. So we are very flexible with scheduling, so if they want to participate in something like this, they can flex their day, start late, or, take a Friday off or whatnot. So we definitely want to include them in these efforts.
I would say at Adult and Child, we have a lot of task force that probably do a lot of the outreach for us. Like we have a DEIB task force, an LGBTQ plus task force, and a HOPE task force. And so we do try to engage in a lot of those community events and participate and help kind of in the leadership roles of some of those things. And then we also have a homeless resource team that they kind of go out every Wednesday and do some work there. That is an opportunity for interns to get involved with our community in that way as well.
Thank you. And then I did see one more question come through in the chat. Eva, thank you for the question. I will give a general response to this question, and then I will let site speak specifically. But the question is related to supervision. So what does supervision typically look like at each site, and how do supervisors work with interns to identify training gaps and provide feedback when areas for growth are identified? That's a great question. So speaking generally, interns are required to have at least 4 hours of supervision every week. 2 of those hours will come face-to-face with your primary or principal supervisor, so a fully licensed psychologist that's meeting with you individually for up to 2 hours a week for that. And then the other 2 hours can be those ancillary or additional supervision activities like group supervision or working with other disciplines and things like that that fall into those other 2 hours. And all of our sites are really great at working, supervision is approached similarly to other training models in kind of a scaffolded manner, in which at the beginning, there's probably going to be a lot more hands-on direct supervision, observation, things like that. Whereas over the course of the year, you're becoming more and more independent. But those 4 hours of supervision remain consistent throughout the entire internship year, regardless of where you are in that developmental progression, which allows you to have that security and consistency of knowing that supervision is going to happen routinely, and you're able to bring those concerns in, and that supervision really kind of grows and develops with you as you grow and develop over the course of your year. So anyone else want to speak to any uniqueness in your models of supervision and what you all offer?
I was going to say at Valley Oaks, you typically are working with at least 3 different supervisors. You have your primary supervisor, and then the rotation day, you're at a different site. So you meet with that supervisor, you have a supervisor for assessment, and then we also do group supervision every other week. So lots of different touch points and different perspectives, which I think can be helpful because we all have different orientations and how we kind of conceptualize clients and things. So it's helpful to bounce those ideas off of other supervisors.
Yeah, we have a lot of supervision as well. The 2 hours of individual with your primary, and then we have 2 hours every other week, meeting with the cohort and myself to staff cases, to talk about psychology stuff, to sometimes even have a little fun. And then every other week, you meet with our testing supervisor for group supervision, and then set up some individual supervision as needed with her as well. We also have you attend team meetings with whatever team you're assigned to. And the expectation is that you participate and you add to the discussions of cases, because you have a lot more education and possibly experience than some of our newly hired therapists, and sort of expect that to be shared. So there is supervision a lot. If supervision is needed, if you finish supervision and then you get some suicidal, homicidal, very crazy client, there is always a supervisor immediately available for you, because it's our license that you're practicing under, and we need them.
One other thing I might add that I didn't mention at the beginning, in addition to supervision and the work that you all will be doing on site, you will also have didactic trainings that you are attending, and those cover a variety of different topics. And so it's a really good supplement to the work that you're doing at the site and the hands-on experiences that you're having and the supervision that you're having consistently, that you'll get exposed to a wide variety of different training topics that, some of them you might already be very familiar with and comfortable with, and others might be, more unique and nuanced. And so it's throughout the course of that year, you will get to those didactic trainings. They don't happen every week, but they do happen several times a month. So anywhere from 2 to 3 times a month that you'll be in a didactic training. So it gives you that additional resource for learning and growing and developing throughout the course of the year. And I think we had one more question that came through in the chat. Which are the main treatment models that the clinics tend to administer? Anyone want to speak to some of the different, your different treatment approaches?
I can jump on that. And Stephanie, we currently have an intern from your university. But we are primarily evidence-based, mostly CBT-esque, and all the other cousins of CBT. So, you know, it's interesting because interns come in with a whole lot of different ways of conceptualizing. And that's fine. We have our supervisors can speak multiple languages in terms of conceptualization, but for reimbursement purposes with Medicaid, they really want to see some evidence-based protocols that are used.
Thank you, Dr. Sklar. Anyone else, any other sites want to speak to that?
I'll piggyback on what you're saying, Dr. Sklar, and say that we're similar. We incorporate a lot of motivational interviewing, of course, you know, especially in our work with individuals with substance use disorders. We tend to rely heavily on motivational interviewing, so you'll see that a lot. We have several therapists who are ACT certified, so use a lot of that. We also have 10 clinicians who are EMDR certified. So we tend to incorporate that, especially with individuals who are managing trauma and, you know, things along those lines. And then for our substance use groups, we incorporate lots of DBT, we look at matrix, you know, so we have lots of different things that we incorporate. We have 2 psychologists here who are very invested in DBT and do a ton of DBT training. We have a weekly ongoing DBT consultation group. So we continue to provide didactic training internally as well as some consultation throughout the year.
I may add just one more talking point to that, like you mentioned, Dr. Dross-Gonzalez, that many of our sites, the majority of our sites in the Great Lakes region have multiple supervisors, as was mentioned earlier. So with that also comes, you know, the supervisors have training in a lot of different models and modalities and approaches and orientations. And so as an intern, you will get exposed to all of those, and your supervisor may challenge you to think of something from a different perspective, clinical orientation and perspective. So it really, supervision is one of those things that every year, year over year, we get a lot of positive feedback about, because the sites are able to get you paired with a supervisor that really fits with what you're looking to do and what you want to do over the course of that training year, and also a supervisory team that will bring a lot of different approaches, considerations, and be able to provide you just a very well-rounded approach to supervision. Another question that came through: do you prefer interns with a particular research background? And our specific research experiences heavily considered in the application process? Anyone want to speak to that?
I would just say for adult and child, it's probably more of, we'd like to see interns who recognize the importance of research, right? Because we utilize that to support our treatments and different things like that. But I would say that we're not going to, topic wise, and things that someone's studying would not necessarily trump somebody else, but more so just recognizing the value that it holds.
Thank you.
Excuse me, may I ask a few questions?
Please.
Thank you. First, I want to say thank you so much for organizing this open house before we actually have chance to submit application. It's really helpful. And I do have 2 questions. First question, what are most common diagnoses across your site? And the second questions, what is the average length of the treatment you offer at your residential units?
So common diagnoses you all see across the clients that you work with, and average length of treatment, yes? Thank you for those questions. Anyone want to speak to that from your site's perspectives?
Well, just off the top of my head, open up the DSM and as I said earlier, point to a page and you will see it. We have a population with a lot of substance abuse, a lot of trauma. So we certainly see that. Depression, anxiety, even some adjustment disorders come across once in a while. And my reaction to that is, what? Is that all there is? But usually our our populations are pretty, the population we have is pretty complex, which kind of addresses that other issue about people coming in with some experience. You know, we want you to come in with good therapeutic chops, or else our population can be very, very challenging to deal with. So, you know, we see a lot of everything, a lot of substance abuse, a lot of trauma, mood disorders, and a number of people who are on that severe and persistent mentally ill part of things.
Anyone
I
else?
would
Dr.
echo
Griffin, I
that.
saw you take up.
Yep, I would echo that. And I would say for length of treatment, I think it just depends on the patient. We have the flexibility if we need a briefer model, they only need 30-minute sessions, or they need once a month, like we can do that. And then there are the individuals that have had extensive trauma, are really struggling, that are going to maybe need a longer term care.
Thank you. Anyone else want to jump in on either of those questions? I might go back and I just wanted to piggyback off of the question on research also, and kind of circle back to that, and then we can, you know, any other questions that come up. It looks like we have about 10 minutes left, but one thing I wanted to add in, and I think it was, you know, it has been mentioned, of course, as you're coming in, you're going to come in with lots of different experiences and, you know, different points even in your dissertation process and where you're at on that. And the sites are really good about, you know, of course, working with you based on where you're coming in and what experiences you have, where you are with dissertation, all of that. We do have dedicated time. It's 2 hours a week that we dedicate to journal article review. And the reason that we do that is to make sure that that's still protected, and to say we are invested in you continuing to advance yourself and advance your knowledge over the course of the year. And of course, you're going to do that in supervision and different trainings and didactics and all of that. We also want to make sure you have that time dedicated for yourself to continue to do research. And some of that, especially early on, may be you're working with a client with a diagnosis that you're less familiar with, and you're going to do a deep dive and dive in and try to gather a lot of research. You can use it for that. You can use it for dissertation. You can use it if there is something that you just have a real passion for, and you want to spend some time really researching that, investing in that, potentially some program development at your site. Maybe that's a new group that the site is interested in launching, and you're interested in helping facilitate. So being able to use that time, but also working with your sites to say, if you have a real passion for research, most of our sites are going to be open to say, how do we tap into that passion and interest that you have, with also some of our needs in some program development or some different research opportunities or grants or things like that. So just talk with your sites about that if that is something that you are passionate about and want to continue over the course of your internship year, because the sites are generally very good about working with you to make sure you have continued opportunities in those areas. Okay, with just a few minutes left, any other lingering questions? We have one more for Dr. Griffin. Dr. Griffin, would you be able to speak more about the testing opportunities at Bowen? I'd love to focus more of my training on a testing heavy track, if you will. Is that an option? So Dr. Griffin, I would ask you to obviously answer, since that was directed at you, and any other sites that want to jump in and talk about your testing opportunities after Dr. Griffin is done, you are more than welcome.
I would say yes, there is the opportunity to kind of make that more of an emphasis during internship. The types of testing that our interns typically do are kind of these brief ADHD consultations. They also do diagnostic clarification testing for our community partners, so DCS, juvenile probation. Sometimes we get referrals from adult probation. If a patient is able to self-pay, interns are able to kind of provide testing on those. So sometimes there's also certain offices that do kind of fitness for duty type testing. Sometimes we get bariatric assessments. Those are the main ones. And then to be There's the shadowing opportunities for the ADOS and autism evaluations. We do try to do training on like attachment and bonding types of evaluations, and then some on like criminal responsibility and competency to stand trial. Interns are able to do those testings or shadow them, but we'd give training on those and kind of talk about cases, that type of thing. Those are the main testing opportunities that we have that are coming to mind right now.
Thank you. Anyone else want to jump in on that of testing opportunities? And if someone wanted a kind of a heavier approach to testing, is that something that you all offer?
So at Valley Oaks, there's a minimum amount that every intern completes, and you do 4 hours of testing per week. But if you're interested, Dr. Plaskanka is our psychologist who oversees that. So she is definitely added additional if you've wanted to focus more of your internship on that.
Yeah, we usually want about 6 batteries from each intern. We have a 1.5 year long wait list for testing at this point, and we're trying to pare that down because sometimes the need just doesn't exist anymore. But they're usually fairly full batteries, ADD testing, a lot of diagnostic clarification. We tend to do all our testing referrals are more in-house in terms of from psychiatry or other clinical staff at this point. But if you want to do a whole lot more than that 6, we will be very happy.
The need is there. If you would like to do more, the demand is there. Yeah.
You betcha. I
Yeah,
think part of the
thank you.
challenge is juggling all the limited number of testing materials. And we have a pretty broad range of stuff, but it's monitoring the calendar of who has what where that
Yes.
becomes a challenge.
Thank you very much. And we had one other question that's being answered by several of you in chat, and then I might speak more generally about it. It is about practicum students and the ability to supervise and provide supervision to that. So I'm going to speak generally. Several of you have already replied in the chat, but I will open it up if any of you want to reply. Take yourself off mute and reply as well. So as far as supervision is one of those areas of core competency that APA wants to see you develop throughout the course of your internship year. So it is something that we do look at and evaluate over the course of the internship year. Now that can take one of 2 different forms and or maybe a combination of both of those. That many of our sites in our Great Lakes region have the ability for you to provide direct supervision to either practicum students or entry-level trainees. And if they do not have the opportunity for you to provide that direct hands-on supervision experience, they will have mock supervision opportunities. So you will be working on developing those supervision skills, those supervisory skills throughout the course of your internship year. And the sites will be working with you to make sure that there are different avenues for you to develop those skills. So either direct and or mock. And so, like I said, it could take on a couple forms. You could do some direct supervision in addition to the mock supervision environments, or they may just have some of that direct experience throughout the course of the year or the mock environment. But at any rate, there is that investment in your supervisory skills and your ability to develop those skills over the course of the internship year. Does anyone want to speak to the delivery of supervision to those entry-level individuals or prac students? Anyone have anything that they want to speak to from their site perspective? Okay. Well, that is wraps us up pretty nicely right at the end of our time here. So like we said at the beginning, if you didn't have a chance to ask some questions and you have anything lingering and or you think of something later, please don't hesitate to reach out to us by email. If afterwards, you think of something else, reach out to us. I know all of our training directors in the Great Lakes region are also open to any questions that you might have. But you are more than welcome to submit any and all questions to Mallory, and she can send them along to the respective training director in the regions if you are having a hard time piecing together who's who and which sites they belong to. We know it's a lot to try to absorb. So Mallory is a good central point of contact if you have any questions following today. And we are so happy to have you all here today. And we hope that we see you again very soon. And hopefully we connect and are able to match with you all during our match process. So thank you for joining.